said, confused and overwhelmed, you're in the right place, especially if you're confused and overwhelmed about Medicare. Other things, I don't know if Gary would be able to help you with or not, but if you're confused and overwhelmed about Medicare, he's here. We're really glad to have everybody here this afternoon. I understand that when Gary started doing this presentation for SaddleBrooke, they scheduled a small room for 30 people and 40 people showed up. So as you can see, it's grown to the larger room. And Gary Anderson is here every year. Some of you may, how many of you have been here before? Okay, great. As you know, it's excellent information just to get an overview of Medicare if you're going in for the first time. Updates if you're already in Medicare and if you're trying to make decisions about what to do during this open enrollment period. There'll be information on that too. Gary is an independent insurance broker, but today he's here as an educator. And that means there'll be no discussion of companies, no marketing information, and he'll set you straight if you get out of line. But he will be here strictly as an educator to help us understand the various parts of Medicare. Gary loves helping people. He gives these presentations around Tucson to facilities, groups such as ours, medical providers, and stays up to date with what's going on in the Medicare, Parts A and B, Medigap, Advantage plans, and Part D. So there'll be a lot of information here. I'm going to turn it over to Gary and welcome him back to SaddleBrooke. Gary?
Thank you, Phyllis. I love being out here at SaddleBrooke. I'm really glad to be here. I come out every year. I'm always humbled that there's a show of hands. How many of you have been here before and you're coming again? And I would say that's painful, but I'm glad you're here because there is a lot of information. You know, it's a beautiful day. And you could be golfing, riding a bike, you could be pickleball. There's a whole lot of things you could be doing than listening to me talk about Medicare. And I'm just going to say something. This is not fun. This is not fun. But it's really important. The decisions that you make are critically important. So let me tell you a little bit about myself here. I've been in a lot of your homes. I had somebody last week that said to me, Gary, why in the world are you doing this? This is maddening. And we laughed, we chuckled. And I said, you know, there's nothing more satisfying than leaving somebody's house and there's one more person that has all the puzzles, all the pieces of the puzzles for this thing called Medicare. There's just a lot of information. You get bombarded with mail, there's TV commercials. We are right now today in the annual election period that we all call open enrollment. And so you're getting all this stuff constantly and you're trying to make a decision. So I love being independent. I have 6 kids. My wife and I have been married 34 years. We have 8 grandchildren, 2 in New York. We have 3 grandkids there. We have 1 child in the daughter. One of our twins is in the military with her husband. They're in South Carolina. We have 3 here. We are full speed. If you come to our house, it's going to be a lot of activity. If you're a person that likes peace and quiet, we will stress you out. If you like that and you're energized, you'd love being around our place because it is always full. Now, we're empty nesters like you are, so we're entering a different phase of life. And so that's a little bit about me. I represent a lot of different companies. I represent Blue Cross Blue Shield, ARP United Healthcare, Physicians Mutual, Aflac, Caremore, Cigna, Aetna, HealthNet, Allwell, Silver Script, WellCare. I mean, just a lot of plans out there. I know them inside out. And so I love imparting information, empowering you. I started doing these seminars at a local hospital, and I'll never forget one of the caseworkers said to me, Gary, we're down here at the hospital, we're pretty confused. And several of them said that. And I said, no, think about what you guys are saying. You do this every day, processing claims, and you're interacting with people on Medicare, and you're telling me that you're confused. Can you imagine what the public feels? And I had somebody in one of these seminars several years ago come up to me, and a brilliant individual, several PhDs, spoke several languages. You know, he's retiring, but very frustrated because he could not understand Medicare. You're not being insulted by your intelligence. I had somebody yesterday that said, I've been reading for 3 months, and the more I read, the more I'm confused. And this unfortunately has been the story that I hear a lot. We're in a crisis. We do not have great insurance options until you get to 65. I'm 59. I wish I could get to Medicare. I'm telling you, I wish I could get to Medicare. Now, I know when you get to Medicare, it's, well, my parents are on Medicare. I shouldn't be on Medicare. But you have some really good options when you get there. How many are on Medicare right now? Gosh, a lot of you. Okay. How many are going to be in Medicare in the next couple of years? Okay. All right. What's interesting about that is I saw about 80% at least were already on Medicare. That's what amazes me that you come out, because there are things that I'm going to say that people always say to me every year, I've never heard that. I've never read that. And the question and answer session is very informative and interactive. But I know you've come with a lot of expectations. You are here because you want to know, do I change? This is the big change time. Do I change? There's a lot of changes going on right now. And I'm going to address some of those, because I get calls almost every day talking about some of the things that I'm hearing that are quite honestly fraudulent. And people are trying to sell you something and put fear in you, and I'm going to address some of that. Do I stay? What am I missing? Do you realize, according to the statistics and some surveys that have been done across the United States, the number one fear of people going into Medicare is making the wrong decision. And then the thought is, but I can always change. That is not true. And that's a big statement right there, what I just said. So I'm going to address that a little bit here as we go forward. But let me set up our expectations here. My role this afternoon, as Phyllis said, is that I am an educator right now. I do represent a lot of different insurance companies. I cannot steer. I cannot give an opinion. I will bite my tongue because I have a lot of opinions, but I cannot give them to you in this venue. I cannot talk about any companies, products, co-pays, networks, what's not being accepted, what's accepted. Those are marketing questions that I'm not allowed to address, but you can certainly ask me after this venue, not in this room, because we're still in an educational seminar. But you can ask me anything you want and call me later. You'll see on your notes that you don't have any of my personal information. I cannot put my information on those notes because that is marketing. You're a captive audience. And that is one of the criticisms of people doing a gathering like this, is you get bombarded with phone calls and emails and you're trying to be sold. I cannot do that. So if you want one of my cards, feel free to ask Phyllis. She'll have some of my cards. I have a limited number. I was starting to run out. But you can take a picture of it. Feel free to do that, or you can come up to me and we can take a picture of it. I just can't hand it out to you during this seminar. So I am going to empower you with information. That is the best thing I can think of doing this afternoon. It is like a big puzzle. You know, our kids love puzzles. We put puzzles together, and as they got older, they get more and more intricate and more involved, and there's nothing worse than getting to the end of that puzzle, and there's one missing. And you're looking for that piece for days. And I'm telling you, you're looking for some pieces of Medicare, and you're not finding it. And I'm going to be very candid with you. I'm going to tell you some things that you'll never read. It's not in the literature. It's not in anything. But I can't go over the line, but I'm going to say some things to just hopefully allow you to be aware of some of the things you need to be considering. So, I'm going to stop midway. I'm going to allow you to ask a couple of questions. You're going to have a lot of questions. But I'm going to stop midway. I'll open it up for maybe a couple of questions, and then I'm going to stop, and we'll take a pause. That'll be the end of the session. Then if you want to stay for the live question and answer session, feel free to do that. But again, I know that your questions may be very individual. And again, I'll be glad to help evaluate your plan. I will tell you what I know. I often will hear people say that, oh, I've got something, I don't know what I've got, and I'll meet and I'll say, I think you need to stay. Brokers there's a lot of great brokers in town. We are educators, we're also agents, but our role is to help come alongside of you in giving you the best education that we can so that you can make the decision that you personally feel is best for you. And that's really our goal. And so anyway, let me just start with saying that so that you know that I'm not going to say anything specific. And here we go, confused and overwhelmed. That is the theme. I can't think of anything better to say. Confused and overwhelmed. Well, anything better to say. That's not a great thing to say. That's not a great thing. We don't want to be confused and overwhelmed. And we want this to be crystal clear. And that is my goal. And if you leave here, and I say this all the time, if you leave here and your head is spinning, I have utterly failed as a communicator. So I've got to be careful of what I say. I could talk and talk and talk, and it'll get painful. So I'm going to try to be real clear. And if I start talking fast, please raise your hand and stop me. If I start getting a southern drawl and it starts slurring and it's not making sense, that just adds to confusion and overwhelm. So I will not be offended. Just raise your hand and tell me, Gary, wait, stop. Okay. So, confusion and overwhelm. Where do I start? I don't even know where to begin. I've asked a lot of agents in town, who do home and auto and other kinds of things, where do your clients go? Gary, I don't know where they go because they don't come to me, because I don't do that. I think most people do what their friends do, quite honestly. I think they just ask a lot of questions and kind of do what their friends do. And I'll never forget somebody out here was on the golf course and about 8 people on the tee box, and they were talking about, what do you have, what do you have, what do you have? And it came to the conclusion that this guy that was asking the questions, nobody knew what they had. And they just kind of chuckled. Said, well, I guess open enrollment's coming, well maybe we can check it out then. So where do I start? You've got about 40 Medicare Advantage plans. Those are HMO and PPO plans. You have 12 supplement plans. And this year there's over 30 drug plans. So I'm going to touch on that. The biggest and the most important thing for you to understand is Medicare Advantage and Medicare Supplement. So I'm going to talk about that a lot, and that's really going to shape what I say. So really, you've got about 100 choices. I'll see this, just stacks of mail, it's everywhere. And I am very aware of that mail. It's marketing, sign this, we'll get you some information, you get bombarded with phone calls, you get more mail, and it's hard. It's hard to get some good information. Usually people just stack it up and say, well, let's get kindling for the fire that's coming, for our short winter here. I'm going to use that for kindling. So anyway, CMS, here's Centers for Medicare and Medicaid Services. The average annual out-of-pocket medical cost for 65 to 74-year-olds is over $4,000 a year. That's 11% of your household income. As we get to 85 and older, we will get to $6,600 in medical costs. What we see is that our greatest needs as we get older is going to be our medical. I think the question that we all need to ask, what decision would position me for the kind of care that I want as I get older, realizing I may not be able to change? That's a real important question. And it's a hard one to answer, honestly, because this really does involve your budget, the kind of care you want, how risky you are, your values, and it's very, very unique in every single situation. So this is USA Today, March 15th, so these numbers are even higher now in terms of our costs. You have, when you came in, you have I call it a healthcare pie. It's just illustrating all the gaps in Medicare. When we get to long-term care, when we need help with daily activities of daily living, those are not covered by Medicare. So you have partial doctor, hospital, labs, blood, and so forth is covered. So this would illustrate why you need to do something for your Medicare when you sign up for A and B. There's 4 parts, and I'm just going to start from the very foundations and real basic, because I have found that what I'm also getting ready to say is really confusing a lot of people with Medicare in terms of A and B. But Hospital Part A, Medical Part B, Medicare Advantage Part C, and Prescriptions Part D. Now when you sign up for Part A, there's a 0 monthly premium. You don't have any monthly premium if you have worked 10 years or you have been married 2 years to somebody who has worked 10 years or 40 quarters. I have seen spouses go back to work and killing themselves trying to get 40 quarters, and you don't have to do that. On a rare occasion, I've seen one situation in the last 9-10 years where somebody did not have Part A. Neither one did. It's actually recent. They both inherited millions of dollars. Both stopped working. Interesting scenario. And never worked. Well, you haven't paid into the system, and now Medicare is going to be costly. Because Part A is, it's not cheap, $300-400. I don't know what next year's rate's going to be, but usually Part A is free. Now, the first thing that's changing is this deductible for Medicare. These are the projected amounts to come out. It's $1,364 now. Next year it'll be $1,420 will be the deductible. That's per event, meaning if you only have your Medicare and you go into the hospital, you would have to pay $1,420. So you want to do something because that continues to go. If you come out of the hospital for 60 days and go back in, you would have to pay that again. So that's a deductible of Part A. That's an overnight stay, a semi-private room, meals, nursing supplies, blood, skilled nursing, hospice. That's Part A. Part B is now going to be $144.30. That has changed. So it was $135.50. Last year it only went up a couple dollars. This year it's gone up a little more. It's gone up about 9 or so. $144.30. That'll automatically come out of your Social Security if you're on Social Security. The Part B deductible is $185 this year. Next year it'll be $197. I've seen it remain constant for 3 years in a row. I've seen this year we had a bigger increase. $197 is the deductible for Part B. This will be all of your outpatient. So this is your primary care physician, specialist, MRI, CAT scan, blood work, urgent care, ambulance, anything outpatient would be billed to Part B. And those would be your costs. If you did not do anything, you'd have a 20% and then $197. There's a new sign-up process, and it used to be that you could just go to Medicare.gov, sign up, and away you go. It used to be you could call a telephone and sign up on the phone. You cannot do that. There's only 2 ways to sign up for Medicare. It's either going to the Social Security office or it is going to Medicare.gov. And I've circled in the top left corner there the easiest way that I have found this to enroll. And that is just to go to Medicare.gov, circle there at the top, sign up, and you will see a drop down that'll take you through a process where you have to sign up for a Social Security account. If you do not have a Social Security account, you'll get a password, usually within 5 minutes. Sometimes it takes 2 weeks to mail it to you. Don't have a reason why if you've not been into your Social Security account and you do have one and you've not gone on to your account for 2 or 3 months, you're locked out. You can't get a password. You've got to go down to Social Security. There are hundreds of people being funneled to Social Security this year. Yes? This is for new people. Yes, the question, is this for new people? Yes. If you've already been on Medicare, no need to sign up. No, you've already got your Medicare. So this is for new people going into Medicare. So you'll do that. You'll go through mysocialsecurity.gov. You will fill out an application there online. You'll get your number within 5 to 10 days. If you don't enroll early enough, you're going to start scrambling to get your number. It used to be the Social Security number. Now it's a unique number. We've got to have that number in order to enroll you in a product. And so you want to start that as early as 3 months before your birthday month. I'm going to talk about A and B here in terms of who needs to enroll in what, but yes.
I just have a question. If you're already on Social Security, somebody said you automatically, you don't have to sign up.
Yeah, the question was if you're on Social Security, thank you. There's so many details, but yeah, that's an important question. If you're already taking Social Security benefits, you do not need to sign up for Medicare. You are on the radar, you'll get your card automatically 3 to 4 months in advance if you're taking Social Security. If you're not, then you're going to have to enroll in Medicare directly on the website. Yeah.
Well, I'm on Part A.
Cameron?
I'm not on Part B.
Okay, I'm going to address.
I'm going to be on. I'm going to need Part B.
Yeah. I'm going to, okay, when you, here, as you're enrolling, and I'm only on A, I'm not on B. I was just getting to say that you do not want to enroll in Medicare if you are working and have employer insurance. Do not enroll in Medicare, especially if you have a health savings account through your employer. You can no longer contribute to that savings account if you sign up for Part A. Part A is free, and people say, well, I'll sign up for Part A. Matter of fact, I hear this all the time. I have to sign up for Part A. You do not have to sign up for Part A when you're working and you have employer insurance. But you especially don't want to do that if you have a health savings account, because that will ruin your ability to contribute. And you cannot make it retroactive. You can't cancel it. It's permanent. So that has gotten a lot of people in trouble this year by enrolling in Part A. So know that you don't have to do that. Now, if you are working and you later go in to Medicare, you cannot do this by going online. You have to take 2 forms. One form you'll fill out, one form your employer will fill out, stating that you have had insurance through the employer. You've got to take those 2 forms to Social Security for them to enroll you in Part B so that you don't have a penalty. I've got a very unique situation I just dealt with last week. He's 68 and doesn't know anything about Medicare, and got my name and said, I don't know why I need Medicare. I live off the land, off of solar, and I don't think I ever will need Medicare. That's very unique. I mean, maybe so. But now he's starting to think, well, the wheels are falling off a little bit, and maybe I need to start enrolling in Medicare. So if that happens, then you get a penalty. For every year that goes by, every 12 months that goes by that you do not enroll, you get a 10% penalty on top of the Part B premium. One other thing I'll say about COBRA, about this whole thing with Medicare. Some people, when they retire and they're eligible for Medicare, get COBRA. It's an extenuation of your insurance for 18 months, and some companies offer it at no charge. Now, it's rare, but I've seen it. Now, if I was in that position, that sounds pretty good. I'd take that COBRA, but I think of a COBRA as a snake. It's not good. COBRA's not good. Because here's what happens. You let 18 months go by, and then you try to enroll in Medicare, and you're not allowed to enroll in Medicare. Because the federal government does not see that as real insurance. And the only time you can enroll in future years would be between January and March 31st, and it doesn't start till July. The whole point is, don't take COBRA. And you could, but only for 8 months. When you retire, then you could take it for no more than 8 months, but you must enroll in Medicare coming off of a employer plan. That's a little bit about A and B, but this is the best way to enroll. And I would say do it early if you're going into Medicare. No earlier than 3 months before your birthday month. And if you're born on the 1st of the month, you get an extra month free. It starts the month before. So that's just how it works. That's what your card's going to look like. It used to be your Social Security numbers, and it's no longer your Social Security. Everyone should be getting a new number, random letters and numbers. If you do not have a new Medicare card by now, and you've been on Medicare, there is a problem, and you should call Social Security. Not Medicare, Social Security, not to confuse the Social Security benefits. This happens all the time. Social Security enrolls you in Social Security, as well as Medicare A and B. So you need to call them if you don't have your card by now. Part C is Medicare Advantage. On your notes there across the top of the page, and then Part D, prescription drugs. You have 3 options. You can do nothing. Just don't do anything. It's rare. I have met somebody. Actually, there's a couple out here who's 90 years old dancing, and oh my goodness, pickleball and active and biking, and why do I need anything else? I've got Medicare. It was not a normal story. I mean, they never had any conditions. And you could do that. You could do only Medicare. If you do that, Medicare is going to pay 80%, but you're going to have to pay the 20% that Medicare doesn't pay, the Part B deductible, and the Part A deductible. And that 20% goes and goes and goes. There is no limit to that. So it's not a great option, really. Second option would be Medicare Advantage. And then the third option is Medicare Supplement. This word supplement is the #1 confusing word in all Medicare. I can tell you the hospital staff have said to me over and over, Gary, people come into the hospital and they say to us as caseworkers, here is my supplement. And the caseworkers say, no, that's not a supplement. That's a replacement plan to Medicare. Now imagine that. Wait. Replacement. And they pull out your A and B card, and here's my A and B. No, I know you have A and B, but you've replaced your Medicare. Now, that's technically true, but it's awfully confusing. What do you mean I've replaced my Medicare? I'm going to talk about that because the word supplement has multiple meanings. Whenever I say the word supplement, I mean Medigap. Currently, those are the letters A, B, C, D, F, G, K, L, M, and N. Those are Medigap plans or supplement plans. So I'm going to paint a picture like we're at the fork in the road. We're hiking, big hiking club out here, very active as I understand. And I love personally the Sabino Canyon, or the Sabino, what's the falls up here? Out of Canyon State Park. You go up there, Romero Pools. You get to a fork in the road, and it's either you kind of go down the nice little different kind of a pool, or you start climbing. And I've got that in my mind because we're at a fork in the road. And you're either going to go down one road called Medicare Advantage, or you're going to go down the other road called Medicare Supplement. You've got to make a decision. You can't do both. It's illegal to do both. So that is really important to understand. Part C, these are individual plans offered by private insurance companies that combine coverage for original Medicare. You've got Part A, hospital, your doctor, Part B, and your drugs, Part D, most of the time. What's going on when you go to Medicare Advantage, and let's just describe this before I go further. The reason the hospital staff are saying you've replaced your Medicare is because really what you're doing when you go to a Medicare Advantage plan is, these are the HMOs and the PPOs, is that you are saying to Medicare, I'm going to give up my rights and options, my entitlements of Medicare, to an individual insurance company. They are now primary, and so they take over the benefits. That's just the way it works. The first reason people really enjoy these are, number one, the premium costs vary, and many of them are zero monthly premium. So people say, gosh, I only go once a year, I save a lot of money, I don't need insurance, I can change later. I hear that all the time. You still have to pay your Part B premium. Now the question that we've got to ask, how do these insurance companies pay your claims? You're not paying anything to them. Where do they get their money? Does anybody know how much they make? A lot, 10,000. 10,000 is actually correct, 10,000 a year if I think I heard that right. It is $800 a month roughly. In other words, your $135.50, next year $144.30, that is collected by Social Security along with tax money, taxes. Out of that pot, about $800 a month goes to these individual insurance companies. So that's where they get their funding. It is a partnership with the federal government. These plans are designed, the doctor networks, the co-pays, the drug costs, sometime in the spring. And then these plans are submitted to the Medicare committee. Medicare approves these plans. Then Medicare gives funding to the plans. That's how it works. And so this is what you're now under the Medicare Advantage plan. People say, I want to take a nuclear stress test, and I got this $250 thing in the mail. Well, how come Medicare doesn't pay 80% of that? It's because Medicare doesn't pay any of your bills. If Medicare gets one of your bills, and they look in your file and they see that you have a Medicare Advantage, an all-inclusive plan, they take that bill and they send it right over to the insurance company that you enrolled in. That's why they're called replacement plans. You're still in Medicare, but you're just now under the benefit structure of the insurance company. So that's where it gets confusing. Part D may be included. Most of the plans do have Part D. Let me say this, if you're enrolling in a plan that does not have drug coverage, and then you enroll in a separate drug plan, it will cancel your medical insurance. Be really careful. It'll cancel it. Most of them have prescription drug plans. If you have the VA, you don't really need it, perhaps. I'm going to get to Part D, the drugs here in a minute. They may have a gym membership. A lot of them have a free gym membership. You get a lot of gym out here. Nice. But you might be able to travel and have multiple gym memberships if you're on Medicare Advantage. Those are the pros. Those are the things that people say, I really love Medicare Advantage. That's what I hear. Now let's go to the negative. First one, oops, out-of-pocket expenses. The way it works is you have co-pays. It's just pay as you go for all of your services, primary care specialist, hospital. I mean, you don't pay those deductibles of Medicare that I talked about. You pay the daily amounts in a hospital, whatever that might be, and you pay co-pays. Whenever your co-pays gets to what's called a maximum out-of-pocket, then you're done for the year. And then that insurance company picks up from that point on. Most of the ones here in Tucson, I know we're in Pinal County, so that's got a whole different scenario going on here. Pinal, just getting right across the road. I know it's a very unique situation. You got to be really careful if you sign up for one of these plans, because you want to make sure that you can go to both Pima and Pinal County. And so you are limited in terms of your choices. So that's just the way it is here. No insurance company can go past $6,700. $6,700 is the maximum set by the federal government. Most of them range between $3,000, $6,700. People say, oh gosh, I'm not even close to that. If you did have a catastrophic year, unlike doing nothing, you would never go past that amount of your out-of-pocket maximum. So that is a benefit. You've got a cutoff there. Co-insurance, this is where it gets interesting. My agent told me that I could go to the hospital and get a double bypass surgery. I could get my knee replaced. I could get back surgery. I could get spine fusions. I mean, on and on and on. And I have no copays. Wow, that sounds like a great plan. I don't know where that is, because it doesn't exist. But you're hearing it. And then you get this bill, and it's $700, $1,500, $2,300. Whoa, wait. What happened there is that whatever procedure you went through goes to the insurance company. They readjust it just like we all know our insurance to be before turning 65. $30,000 submitted and $3,000 approved, something like that. Just throwing a number out. I mean, you'll see those kinds of numbers. Well, the insurance company will pay 80%, and then you'll have 20%. And that's called co-insurance. I call them surprise bills. There's no other way to say it. I could never, ever tell you what the copay or the co-insurance is going to be, because there's over 10,000 medical codes. There is no way that anybody can keep up with all the medical codes, and they don't give that to us. And even if you call the insurance company and say, how much is blank going to cost, they will not tell you. It depends on the code, and that's just the way that is. So that's called co-insurance. The limited network, I'm going to just settle on this a little bit, because this is very important. If you're on a Medicare Advantage plan, you do not have insurance when you leave the county where you live. It is critical to understand this. The literature, all the literature that you read will say under emergency situations, you are covered when you're outside of the county where you live. This is nationwide. Other literature will say if you feel your health is in jeopardy, you are covered. I'd really like to have a better definition than that. That's pretty tough. A lot of people say, I go to the urgent care. That's not a problem, but when you go to the urgent care, they often will send you to the ER. Because we don't have the equipment, you need to go down to the ER. And then you get a bill from the insurance company that says, oh, no, we're not paying that. That's not an emergency. Well, wait a minute, I thought I had coverage. I could spend a lot of time, I'm going to write a book one day, I'm telling you. I've got to write a book on just the stories. I had somebody last year that came up to me, said, I shattered my kneecap. Shattered my kneecap. I was in Colorado, I believe, at the time. I went to Florida, shattered it. I was told by the plan in Colorado I had to come back to Colorado for a shattered kneecap. And she fought, worked the system, went back to Colorado. It was past the 60-day requirement to appeal or to put in a grievance. There's a process. And they shut her down. Nope, you got to pay 100% of that. 92-year-old slipped on the rocks in Seattle. I've said this every year. 92-year-old, oh, no, that's not an emergency. You got to fly back to Tucson. Broken back, no, got to come back to Tucson. I had somebody here visiting from Florida this year, and Florida, what the plan that he was on, I know it well. I'm an agent of that plan. No, not going to pay for that. You got to get back to Florida pretty quick. Not paying for that. You need to understand that the insurance companies have the legal right to determine what they believe is an emergency. That is really, really important. So none of us would ever think, if we're in an emergency situation where we're urgently needing care, I'm not thinking about my insurance really. I mean, I'm thinking about just getting into the hospital with just I got to take care of this. I will say if you're admitted to the hospital, I've never seen a situation where that was denied. You're going to be covered if it's inside in the hospital, but it's at the discretion of the insurance companies. I mean, yeah.
Is that state or county?
Okay, the question was, is that state or county? That is county. County, not state. Now, I want to make this clear. If you have an HMO, that's county. You have to get a referral. You have to go to the doctors in the county. If you go to the doctors outside of that area, then you have to pay for all claims. If it's a PPO, you can go in or out of the network. If you go out of the network, of course, you have more coverage throughout states, some of them throughout other states. But I'm going to tell you, I've read the literature and it bothers me, quite candidly. We had to take about 30 or 40 tests to go through all this in a national test to get recertified by all these products to represent these companies. And when I read a statement that says, if a doctor takes a PPO, no, I'm sorry, rephrase that. If a doctor takes Medicare, that doctor will take your Medicare Advantage PPO. That is absolutely 100% incorrect. Absolutely. The doctor does not have to take Medicare Advantage plans just because you have a PPO and you have coverage outside of the network of the county where you live. So a lot of you have second homes, motor homes, you travel, you see your kids, grandkids, and so I hear this all the time. When people turn 65, we're active. We go, we travel, we do, we see, and we all think we're covered, but you may not be. That's just a real important puzzle piece. That's probably the biggest piece I'm going to give you today in terms of that coverage. And again, it's not right or wrong, good or bad. There are some great options to consider in this type of plan. It's just tailored to each individual story and person. Let me go into a couple more points, then I'm going to stop and ask a couple of questions because I see a couple of people here with questions. Let me go into a couple more. Hold your thought. I'm going to pause here in a minute. Healthcare reform. I'm not going to say a whole lot about that. I will say during the Obama administration, there was a very real conversation, I'm trying to think of the word, to defund Medicare Advantage plans. And I've been saying for years, and I've backed off now because I just don't know. And what I've been saying is that where's all this money coming from to help people who are under 65 getting subsidies? Where's that money coming from? Just printing it? We're just going into more debt as a country? I mean, where's that money coming from? Well, there was a very real situation during the Obama administration that we're going to defund Medicare Advantage. So are they going to get $800 a month, $700, $600, $500? What do these companies get? And with the insurance companies not knowing what they're going to get, how do you run a business not knowing what you're going to get on a monthly basis? They've got to know what they're going to pay the doctors, the claims, so they're trying to figure this out. Well, that's why I've been saying that the out-of-network has been squeezed over the last 10 years. Because I can tell you 10 years ago, you're not going to hear somebody say to a 92-year-old, I'm sorry, but your shattered hip, you're going to have to get on an airplane and come back to Tucson. You just didn't hear that. But I hear it all the time. And that's why I said you got to really understand that. Now, healthcare reform, just to let you understand, Medicare Advantage is growing. There's statistics that says within 10 years, 40% will be on Medicare Advantage. Right now, it's about a third of the country. A third is on Medicare Supplement or Medigap. And a third is on employer retiree plans. It's pretty evenly distributed. I don't think they're going away. The funding has continued. It actually got a bump this year in terms of the subsidy that they're getting for Medicare Advantage. So these change each year. The lock-in. I'm going to mention something now about this lock-in because if you're on a Medicare Advantage plan, I wish I had a GoPro on my head because of the reaction I'm getting ready to say, because I can film your reactions. If you're on a Medicare Advantage plan for a year, and then you say, oh, this is time to change. Because Gary just said I might not have insurance, and I just don't know, I need to evaluate it. So I'm going to get out of that system, and I'm going to go back to what's called original Medicare, and I'm going to pick up a supplement. You may not be eligible if you have a pre-existing condition. You may not be eligible. There are pre-existing conditions all over Medicare. Now, the one condition for Medicare Advantage is kidney failure. If you have kidney failure, you cannot get a Medicare Advantage plan. Dialysis. That is the one big pre-existing. But the insurance companies can determine whether or not they're going to take you. They have the legal right to do that. So once you've had your Medicare for a year, you've got Medicare Advantage, you want to get out of that, you have to go through medical questions to qualify. Some insurance companies will say no. Some will say, yeah, we'll take you, but it'll be more than double the price. It might be 3 times the price of the preferred rate at your age. So that would be a risk in terms of, wondering, should I make a change? And again, it's hard. If you're healthy, limited budget, limited income, retired, it's a hard decision for each person. This period that we're in is called annual election period. Medicare has been trying really hard to get us as agents to stop saying open enrollment. You all are calling it open enrollment. It's really not. It's called annual election period. Did you know that open enrollment is January 1 through March 31st? You've never heard about it. Here's why. Nobody is allowed to market January 1 to March 31st. That's called open enrollment period. Open enrollment period. It is a new thing that started this year. Now, annual election period. What is that? You can change as many times as you want from one Medicare Advantage to another. You can cancel your prescription drug plan, sign up for another prescription drug plan. You can get out of this and go to Medicare Supplement. You can do all kinds of switching around, and you can do that as much as you want. Isn't that fun? You can do that as much as you want until December 7th midnight. December 7th midnight, whatever's postmarked, stamped with a Medicare is what you have. Now we get into January 1. Medicare says, well, here's a look-back period. You got one more chance. It's called open enrollment period. This is an opportunity. If you're on a Medicare Advantage, you can make one election to go to another Medicare Advantage plan of your choice. Or you could get out of that Medicare Advantage plan and go back to what's called original Medicare and get a supplement and a prescription drug plan. You cannot, if you're on a supplement with Medicare, this is not the time period for you to get a different Part D. So this is real important as you start thinking about prescription drugs, which is another thing I'm going to come to here in a minute, because this is the time to evaluate prescription drugs. So anyway, this time period of January 1 to March 31st cannot be advertised. It is your legal right and option. Companies cannot market. They cannot contact you. They cannot talk about their benefits. They cannot sway you. So you're not going to hear about it. You're not going to see TV commercials. You're not going to see any literature. But it is your legal right from January 1 to March 31st. So that's a new change. That's important. So let me just stop here. That's Medicare Advantage. I haven't gone into any details. There's a couple of questions, and then we'll go to the next section here. Yes?
You have a Medicare Advantage plan and it includes Part D. Do you also pay Medicare for Part D as well?
The question was, if you have Medicare and Medicare Advantage, do you also pay the Part B premium, you mean?
Part D.
Part D. No. Part D. Do you pay the Part D premium? There is no Part D premium inside Medicare Advantage. There's no cost. It's all embedded. It's an all-inclusive kind of a plan. So you don't have any, you just, whatever that premium is, and it's usually zero. There's others that have a monthly premium, but many of them have a zero monthly premium. But the prescription drug plan is in that. You have to make sure that they're covered. Yeah.
No, I know you don't pay the Medicare Advantage plan, but you still pay Medicare itself, like when you pay for D, you also pay for D.
Okay, if you're in Medicare Advantage, no, you don't. You still pay for B, but you do not pay for D. If you sign up for an individual D, it cancels your Medicare Advantage. So don't sign up for an individual Part D. You do have co-pays for your drugs. You're going to have that. So you're going to have expenses for your drugs, but you're not getting a separate drug plan if you're on Medicare Advantage. I think there's, yes. Over here. Yeah. Yes.
Okay, this is something interesting that I found out after I was in an automobile accident here in Pima County.
Pinal County. Here in Pinal, you mean?
I mean Pinal
Okay.
County. Excuse me. I didn't realize that when I have, because I have an HMO, not a PPO, that services for home health care is not included by some of the agents or companies in Pima County. I needed home health care. I was not entitled to it because I lived in Pinell County, or in SaddleBrooke.
So I was in an automobile accident, and I didn't know that I was not entitled to home health care after the accident. The home health care, again, that's a specific benefit on each of those Advantage plans. That varies from plan to plan. So in your experience, for whatever it was, the insurance company said, you are not eligible for home health care. That was what they determined. But there are plans, depending on, again, it depends on the situation. They make the decision whether or not you have home health care based on.
I will.
Yeah. So that, yes.
If you go under the Advantage plan and you talk to your private insurance, will they give you a list of the HMOs or the PPOs in the area?
If you call your insurance company?
Yeah, I mean, you obviously are going to go to a broker or whoever. Can you get a list of the HMOs or PPOs in Pinell County, for instance?
Okay, the question is, can you get a list of the HMO and PPOs in Pinell County? The best way to do that, you could call the insurance company and ask them what plans they have available in this county. The other way to do that is go to Medicare.gov.
Okay.
Medicare.gov. It's going to be all listed. It'll be all listed, and it's also in the Medicare and U book. But the best source would be the Medicare.gov.
But does that change from plan to plan? You said there were, what, 40 plans?
Now, in Pinell County, there's less than 40 plans, so I've made a general statement about Pima and Pinell. But in Pinell County, you'll be able to see a current list of the 2020 plans coming out. It was posted October 1, and you have an opportunity now to change until December 7th. That is the deadline.
Okay,
Yeah.
thank you.
Yes.
That copay number 6700K,
Uh-huh.
D without the K.
Is that sick?
Yes.
6,700K. 67, yeah, thank you. It's not 67,000. You're the first person in all these years that pointed that out. It is not 67,000. 6,700, thank you. I will take out that K and put a dollar sign next year. Okay, thank you. Yes.
Talking about not having coverage outside of your county, there's some programs that have a passport program.
Okay, the question, I can't talk about it, but I'll just say, I'll repeat the question because now you're talking about the detail of a plan. There are some plans that have a benefit. I won't even repeat what he said. But there is a plan that has a benefit that transfers to other counties. Yeah, there's a plan. There are plans that transfers to other counties, and it's unique to that particular carrier. That's I can't say it. I'm biting my tongue. Yes.
My concern is we're in Pinell, and a lot of the specialists will say, or doctors will say, are in Pima. So if you sign up based on your residence, but you want to see a doctor in Oro Valley, are you going to be covered? Or?
Yeah, the question, since we're in Pinell, I'm concerned that we're going to get coverage in Pima County and Tucson. I will say this, yeah, you do. There are plans that are going to go back and forth between Pinell and Pima. You've got to be careful though, because there are situations where if you choose a primary care physician in Pinell, you have to go to Florence to the hospital. You're out of network if you go to Pima County. You've got to be careful. This is really tricky with Pinell. Don't you love being in Pinell? Okay, yes, over here.
The Part D, you said you can't go to a different drug plan, you'll be dropped from your insurance if they have it. But like if you use an RX card and go to the pharmacy, are you allowed to do that?
Okay, I'm going to address that when we get to the Part D, but just briefly, can you use a discount card when you have your medical insurance in the Part D? I will tell you in the past, it kind of was shunned. It was kind of, well, you're already on Medicare, we're going to have to run it through your insurance. I will tell you there are some things now that I've seen in the last 2 years that yes, the answer is yes, you can use a discount card. You cannot use both. It's either or, the discount card or your insurance. Let me just take one more and then I'm going to open up to answer question and answers. Yes, yes.
You went to Medicare Advantage. Are you going to talk about supplement?
That's what I'm getting ready to do right now. Yep, I'm going to go to supplement. Let me go to supplement. And we're going to pause here. I'm going to take an open question and answer session. Again, they're really great questions. There's a lot that I feel I wish I'd say. But again, I don't want your heads to spin. I want you to stay engaged. And so let's go on to the next one here, Medicare supplement. There are things that are changing with this coming up in 2020. Take your sheet, the notes, and kind of take the pros and cons and switch those columns. In other words, the cons for Medicare supplement would be that there's a monthly premium. It's not zero. Part D is not included. You have to get a prescription drug plan if you don't want to get a penalty. I'll talk about that when we get to Part D. And they may or may not have a gym membership. Some of them have gym memberships, some of them do not. Now the positive is exactly the opposite of what you see on your sheet. The positive is when you get a plan, you don't have copays, you don't have hospital bills, you don't have medical bills, there are no bills unless Medicare denies the claim. I have listened to something on the internet that needs to be shut down because there is somebody that's advertising that if you're on Medicare with a supplement, that Medicare pays everything but the holes in your head. Eyes, ears, nose, and mouth. That is 100% absolutely false and fraudulent. It needs to be shut down because that's not true. Do you realize you have to have 3 symptoms if you have original Medicare and you have a supplement now? You have to have 3 symptoms for a doctor to be able to run a lab, blood, diagnostic, in order for Medicare to pay for it, a new medical condition. You're not going to hear that because the doctors are asking you lots of questions to try to figure out, do you have enough symptoms for Medicare to pay for it? So when doctors run things for your health, they're trying to make sure that Medicare will pay, that you don't get stuck with a bill. And you're told you've got a supplement and I'm never going to have any bills. That is not true necessarily. You've got to ask, do you take Medicare, of course? And then is Medicare going to cover this? You don't want to be surprised. I've seen $700 to $1,000 blood bills. That's common. A doctor runs a full panel, all kinds of things. Medicare says, no, we're not going to pay for that. No reason to run that, not paying it. $1,500 of blood was run for somebody having back surgery. Goes to Medicare, not paying that. That's preventive care. Doctor thought it was important. $1,500 that person had to pay, even though she had a supplement. So when I make a statement, you don't have any medical or hospital bills, I want to make sure I qualify that statement and really communicate what I'm saying here. As long as Medicare is going to pay that, you would not have a bill, depending on the plan that you bought. You don't have any network, you go anywhere in the country. Do you take Medicare? On another plan, Medicare Advantage, you have to name the company, the plan, the type of plan. You've got to be very, very specific. There's no health care reform. I mean, the plans are the plans. There's no lock-in, meaning if you have a supplemental insurance plan, you have the legal right to change any day of the month, any day of the year throughout the year. There is no open enrollment. People don't realize that. The only reason I see people changing is because the rates go up. Let me mention this. Your rate, if you're on a supplemental insurance plan, the insurance companies here in this state of Arizona has the legal right, the insurance companies have the legal right, to raise your monthly premium 2, 3, 4 times a year. And I've heard this year, when I get phone calls, that my rate's gone up 4 times. Well, wait, well, I thought it just was once a year. No, because the rates are determined by the plan that you bought and from the company you buy it from. And they look in that experience of that group, the plan that you bought, and they look at inflation, healthcare costs, and claims that are submitted. And based on that information, that insurance company has to give a compelling argument to the State Department of Insurance to have a rate increase. So they can raise it more than once a year. And so as you are shopping and looking at prices, beware. There are companies, many, that are doing a bait and switch. Now I've got to really bite my tongue because I'd love to tell you who they are. Because there's a bunch of them. And you could get a rate increase of 30 to 35% in the second year. Now imagine you get that kind of a plan, well, I can always change. And then you go to another company and you've had cancer. And 50% of us as men are going to get cancer, prostate. And if we live long enough, we're all going to get prostate cancer. That's a big deal. And now all of a sudden you want to change and you can't because you've had cancer in the last 2 years. So be really aware of your pricing and shopping. Gosh, I wish I could. Let me do an illustration. If it's not already confusing, I'm going to make this real confusing. I'm going to turn something upside down. And now, let me go ahead and take your question. Yeah.
Can you go back to that thing about the cost for labs, where you say that they can charge for labs?
I don't know if I said 4 labs.
Labs.
Oh, no, 3. I was talking about 3 symptoms. If a doctor is looking for 3 symptoms in order to run labs, blood, so forth, if you're getting your medications renewed, the doctor's going to run blood to be able to renew those medications. And so that's not an issue. Medicare pays for that. But if the doctor starts running vitamin D and lipids and hepatitis and all kinds of other things that Medicare says, no, wait, that's preventive, that is outside of the guidelines of Medicare. Medicare could deny those claims. That's what I was saying about that. Now, if you're being monitored for an ongoing medical condition, you don't have to have 3 symptoms. The doctor's, you're being monitored. So you don't have to, I want to make sure that's clear. I have 3 symptoms and I've had cancer and I don't have 3 symptoms now. No, if you've had a condition, you will be monitored by Medicare. Don't worry about that. The doctors are very aware, usually. If they're not, they need to find out. Make sure that Medicare is going to pay for this. Let me make a statement here, and I did this at the hospital staff once, I don't know, 8 years ago, and 2 people looked at me and just smiled. At the other side, I lost my mind. You're going to think right now, Gary's just lost his mind. I'm going to pull out 3 carriers, and I'm not endorsing any of them. I'm just using this as an illustration to help you to see and understand Medicare supplemental insurance. One, ARP, United Healthcare. ARP is endorsing United Healthcare. It's a partnership. And if you were to get their information, go online, you'll see the chart, A, B, C, D, F, G, K, L, M, and N. It's United Healthcare. The ones in blue are the ones that they're selling. Physicians Mutual is another company. If you go to these guys and open their chart, you're going to see A, B, D, G, K, L, M, N, and then C and F on the side. Then you go to Blue Cross, and Blue Cross Blue Shield, and A, B, C, D, F, G, K, L, M, and N. Now, I am an agent of all 3 of these, and I said this to the hospital years ago, and this will confuse you. This is not Blue Cross. Looks like Blue Cross. It's not Blue Cross. This is not Physicians Mutual. It's got Physicians Mutual all over it. Yeah, Gary's losing his mind right now. This is not United Healthcare, ARP. So what is this? All right, if I took this brochure and took off all the logos, and I've said this every time I meet with you in your home or if I'm doing a seminar, I always say this because I think it's a great illustration. Take off the shield and the cross and put moms and pops of SaddleBrooke. Really bizarre. Now, when I say that, the first thing that comes to my mind is there's no way I'm going to buy my insurance from moms and pops of SaddleBrooke because nobody's heard of it. Well, the doctors take it. So we're so used to that we're always thinking about going with something that you think your doctor will take. Do you realize if there was a plan called Moms and Pops, and it had a good rate, not just a teaser rate, but if it had a good rate and it had rate stability over time, I would absolutely buy my insurance from Moms and Pops because nobody cares. They're all the same. They're all the same. In other words, this chart was designed by Medicare and approved by Congress. Anybody can cut this out, put it in the literature, brand it as Bugs Bunny. It doesn't matter. So if you bought a plan and it goes into your file, all the bills go to Medicare now. Unlike the Medicare Advantage plans, they look in your file and they say, what decision did you make? Oh, you bought Plan F. That's our plan. We designed that. That's ours. Now, who'd you buy it from? Doesn't matter. I heard just 2 weeks ago, oh, we don't take, and it was an obscure company. It's not one that you hear a lot of, but the doctor said, oh, we don't take that plan. I said, you need to go back to that doctor and say, you do. By law, you do. It's federal law, you do. If you take Medicare, you take every single carrier, every single Medicare plan. Because here's what happens when you go into the doctor, the hospital, the caseworkers, You now take your Medicare card and you'll take your supplemental plan, and they'll look at those two cards and say, fantastic, we don't care about that, because they know to bill Medicare as your primary. The secondary is supplement. Medicare is your insurance company. All these guys are the same. What's not the same are rate increases, added value. What do they give in addition to the plan? They can add things to the plan. Financial strength. Those are the things that are different. And that's why I said beware, because when people realize they're all the same, you go and get the cheapest one, or one of the cheapest ones, and then you get hit with rate increase. This is the new chart next year. A, B, D, G, two versions of G, G, high deductible G, K, L, M, N, C, and F, and high deductible F off to the side. I will tell you, I get calls almost every day. And people say, Gary, I had a broker house or a broker call me and say, I'm losing Plan F. That is so fraudulent. Again, that needs to be shut down. That is fraud. If you have Plan F is the one designed to cover your Part A deductible, Part B deductible, and the 20%. Medicare is discontinuing. That's a much better word. Discontinuing Plans F, high deductible F, and C. Do you know why they're discontinuing that? Anybody know? Overuse? Did I hear that? Yeah. There are people actually that are overusing it. And they're going all the time because you can't. You don't have to pay anything except the monthly premium. Medicare says we're paying a lot of money for people that are overusing the plan. So they're shutting down F and C. And so all plans moving forward will have at least the Part B deductible of $197. However, if you turn 65 before January 2020, you will always be able to buy Plans F, high deductible F, and Plan C. So you can still buy it. There will be people 2, 3, 4 years from now that will buy Plan F because they can.
How about if you have it now?
You already have it.
Now, if you already have it, yes. Now, if you already have it, can you keep it? Thank you. That's the next statement I was going to say. This is the important thing. It is grandfathered. It's grandfathered. You will always have Plan F. You don't have to shop. Oh, I got to get G. I got to get C. I got to get in. And, oh my God, you can't get. Don't panic. F is going to be continuing. It's going to be grandfathered forever. Any versions of F that you have will be grandfathered.
Well, won't they raise the premium so high in F that you might want to get out of it?
Okay, here's the logic, and this is now getting into marketing, and I'll just mention something. I have an opinion on it, but I can't give you my opinion. People say, well, Plan F is going to get real expensive, and it's going to, because the pool is going to shrink over time, and people use it and pass away. And well, honestly, Plan J, you probably never heard of Plan J. Plan J's been around. Plan J was grandfathered. I haven't seen Plan J go crazy. So there's all this panic, I think, and it may be unnecessary. Plan F is, if you look at, you can online, it's all over online. It is the biggest plan that people have bought over the last 10 years. It's a very, very large pool. But I understand the logic, and that's why people are shopping and maybe getting into a pool that is going to grow, or a plan that will be offered next year that's going to grow over time. That's the thinking. I hear that all the time. So anyway, yeah.
Will they be changing it? You have to reevaluate each year?
No, there's no changing. I mean, F is F. F will always be F. They're not going to change F. F will just be grandfathered. It's locked in. You're good to go. Yes.
I understand.
Okay, let's go.
When you
Let's go.
make the decision that you want to go with an advantage plan, you have to sign a paper declaring that you're giving up Medicare.
Well, the question is when you're signing a Medicare Advantage plan that you're giving up Medicare. What the applications will say is that, understand, this is not a Medigap plan. That you are giving up, you're assigning your Medicare to an individual insurance company. It's confusing, but yes, you are signing an application to that effect.
How do you get Medicare back if you decide that you don't want to continue with an advantage?
How do you get your Medicare back if you do not want to continue with the Medicare Advantage plan? The best way to do that is now. Now, if you're considering it, you would start considering the plans. You look at the different companies, apply, submit an application. You'll be asked medical questions. You'll get the response back within 2 weeks. Once you get that decision back that yes, we'll take you at the price that we have communicated, the preferred rate, then you sign up for a prescription drug plan. When you sign up for a prescription drug plan, that prescription drug plan will automatically cancel the Medicare Advantage on midnight December 31st. And everything will have a smooth transition January 1. So that's how you do it if you want to go back to original Medicare. Yes?
If you're under F right now with one company, can you move to another company
If
and keep F?
If you're under F with one company, can you move to F with another company? The answer is yes. You can move to another company, another plan. You can always go from F to F to another company. However, there's always underwriting. You always have to go through medical questions. So whenever you make a change, of course the insurance companies want to keep you, but just know that they want to know why you're changing. Is it the rate? Is it, it's usually that. It's usually because you're trying to shop for rate. So they realize that, and so they're going to look at your medical history, and some are more strict than others. They're going to pull the MIB, Medical Information Bureau. It's a permanent database of your records that you cannot erase, as I understand it. And they will pull your doctor records. So that's what they use to evaluate whether or not they'll take you. Yes?
Can you talk
That'll
a
take
little
it.
bit about Part D and the prescription coverage?
I'm going to talk about Part D in just a minute. I'm going to give that, yes.
What is C? I thought
C, yes, C. A, B, C, D, F, G, coming in. Okay, C. This A, B, C, D that you see on the screen is not the A, B, C, D that you see on your notes. The A, B, C, D on your notes is parts, and these are plans. And again, this is what Medicare did. I wish they had a different labeling system than this, maybe, but Plan 1, Plan 2, I don't know, but it does get confusing with the letters. But yeah, these are plans, you have parts, yes.
If I'm going to be on Medicare in July, and if HAP is not available for me, what's the plan that is closest to that?
With those of you who have said that you're going to be going into Medicare, those of you who are going into Medicare next year, January 1st and later, you will not be able to buy Plan F. And you will see that Medicare says that the plan closest to that is Plan G. And so the Plan G is the one that is going to be the one that covers everything except that Part B deductible of $197. So let me mention this. I've also heard complaints about when you go to Medicare.gov, you can see all the plans. You cannot see all the plans. You can see all the Medicare Advantage plans in your county. You can see all of the Part D drug plans in your county. You cannot see the supplemental plans. You cannot get an outline of coverage. Don't know why. You'll see this chart, but you don't know what you're buying. It's really hard. You're going to see there's hundreds of companies you can buy this from. A lot of the big name companies are not even on the website. And so you're wondering, oh, why isn't such and such not, they're not even on the website. I don't know why certain companies are and some aren't, but there's hundreds of companies you can buy this from. So just know that when you go to the website, it may not have the supplemental carriers listed. So that's another thing that I've realized. Yes?
If you have Medicare Advantage now, and you have pre-existing conditions, cancer, heart condition, can you switch to other companies within the Medicare Advantage?
Yeah, the question is if, let's say you have a pre-existing condition and you are on a Medicare Advantage, can I switch to another Medicare Advantage without pre-existing conditions being asked? The question is yes, unless you can go to any other Medicare Advantage if you have a Medicare Advantage. The only thing that you cannot have is end-stage renal failure, kidney failure. If you're on dialysis, then you cannot. Let me keep going to the Part D so I don't run out of time, because I'm going to make a break so that if you want to leave, then some of you have a lot of questions. Let me finish the Part D, that's a big thing. And also the website of Medicare. I'll just mention this right now. I personally use this book. I can't talk about it, but insurance companies don't often use this book. It's a rating agency that tells you the financial strength. It's called WISE. Do you realize that if you go and try to get the financial rating of the insurance companies, that the insurance companies are bribing and paying off the rating agencies? So how good is the rating? WISE does not do that. Weiss does not do that. Out of 1,400 companies in the United States, there's only 7 with an A+ rating. There's only 7. But if you look and go to seminars around town, you're going to get spreadsheets that'll show every single company has an A+ rating. Isn't that interesting? They've all bought their letter. They've all bought their grade. So I use that as a financial strength reference. It's important because I want to know if they're going to increase rates. By the way, if you call, there is a shopper's buyer's guide online. And on page 28, one of the last questions says, for us to call the insurance companies and ask, what are the premiums, what are the increases in premiums for this Medigap supplement plan in the last 3 years due to inflation and other reasons? I can tell you, if you call the insurance companies, you're going to get 2 answers. Because I've done it anonymously. I didn't tell them I was an agent. And I said, yeah, page 28. I'm trying to help somebody with Medicare. I do that all the time, but I didn't tell them that. I'm trying to help somebody with Medicare. Could you please tell me what your rate increases have been in the last 3 years? Medicare tells me to ask you that. 2 answers. Cannot give it to you. Do not have it. You know they have it. You know they have it. If you go to the state commissioner's report, and get that out of Phoenix, it is full of errors. You will not get that information. You cannot get the information. And the only way I have the information is I'm asking thousands of people everywhere I go. Tell me about your rates, tell me about your rates, tell me about your rates. Everywhere I go, I'm compiling information, and I just sometimes feel like I'm a walking encyclopedia. And I'm just trying to keep up. Because you can have a plan where it is a bait and switch. Beware, there are many doing it. And you'd be shocked. If I sat here and told you the names, you'd be shocked. You would be shocked. Let me go to the next one, Part D, real quick here. Part D is prescription drugs. Brand new website. Brand new, October 1. Agents all over the country, including myself, are pulling our hair out. We're screaming. We're trying to figure it out. What did you do? We like the old system. Before, what I would do is somebody wanted me to evaluate their drug plans. I would take your medications and put them in. I'd get an ID number, put it in my file. The next year, I start pulling files out. I do about 200. I just do it as a service. You know, we don't get paid for it. I just do it to help as many as I can. I do that at night. So I'll do as much as I can. But now, agents have to manually type in every drug every time you sit at that screen. Once you leave the screen, you've got to re-enter all those drugs. It's massively painful for agents. But for you, here's the good news. If you want to evaluate your prescriptions, and again, you can do that if you have a Medicare Advantage plan, look at the copays and the tiers and so forth. There's 5 different levels of drugs. But if you are on a supplement and you're trying to evaluate your Part D, there are many changes this year. There are mergers. There are new plans coming out. I saw one plan that tanked, and it used to be my go-to. I've got to really watch this. So the best thing for you and this new website is to go do Find 2020 Health and Drug Plans. When you do that, you'll come to the next screen that says Log In. Make sure you log in. We cannot do that. As a 59-year-old, I wish I could, because I want to get in there, but I can't get your record. I can't get your password. I can't look at your account. That's a HIPAA violation, because inside there is all your medical records, all the claims that have been submitted. In there are all the medications you've been taking. So I can't see that. Agents cannot see that. If you give me permission to run your drug report, yes, then I can go in, but I can't go into an account. When you go into an account, all of your information is stored permanently. You just have it right there. You're going to click on it. Oh, I don't take that one. I take that one. And you just go through the process. And you get to the end. And I got to tell you, on this part of life, you're going to see a real well laid out set of plans that come up as a result. Again, beware. I've already made the mistake many times over the weekend playing with it. I was working on. I'm trying to catch up. It defaults to the lowest monthly premium. Do not think that they're being sorted by the best to the worst. They're being sorted automatically by lowest monthly premium. So when you go in next year and see that lowest monthly premium, you're saying, whoa, I'm doing that one. Don't do that. Over on the right-hand side, there's a little toggle box where it's sorted by monthly premium, sorted by deductibles, or sorted by monthly premium plus drug costs. Make sure you click on the box that says sorted by monthly premium plus drug costs. That will change the entire result. Now, what's great about your situation is that you can play with this all the time. You can go in and put pharmacies, take out, you can only choose 3 at a time. But when I do that, once I leave the screen, I've got to go back and redo the whole thing. So I've got to make sure that whatever I'm doing, I'm done. I'm printing the screenshots, but if somebody wants me to evaluate it again, I'm going to have to start the report all over again. So it's very time consuming for an agent, but I believe it's very, very friendly to you if you're on Medicare. Yes? You have to be on Medicare. You can, okay, let me go to that. Can you look at it ahead of time? Here we go. First of all, if you go to MyMedic, when you set up an account, you'll get a password. It's very, very easy. Within 5 minutes, you'll get a password. You'll verify it, go in. In future sessions, go to mymedicare.gov. That website is your friend. You've got to start getting used to this. mymedicare.gov. We're all going electronically. Insurance companies are now trying to get us to go electronically with processing applications. But personal information is stored. mymedicare.gov. Now, here's what I do. I go into that website and I click on Find Health and Drug Plans, just like you could do without going to mymedicare.gov. But when I get to the screen, as an agent gets to the screen, we've got to click the bottom one. Continue without logging in. I've got to continue as a guest. So I go through that, and I'm going to see the same thing you do, except I'm not inside an account, and nothing is stored. That's just the way it is. I was on a webinar with Medicare over the weekend, and the questions from agents all over the country, well, why is that being stored? And Medicare says, well, you're helping your clients anyway. You're going to be sitting down with them anyway. I'm going to tell you right now, there's no way I'm going to sit down with 500 people and do drug plans. I can't physically possibly do that. I'm going to do as much as I can, because I love helping. So this is why I'm trying to direct people to the website now, because this is really going to be helpful. Yes?
Does this plan automatically adjust if you waited 10 years to sign up, penalty shot?
Okay, if you waited 10 years, does it automatically adjust? I mean, well, let me just talk about that. If you do, a lot of people say, I'm going to go to Walmart, Costco, whatever, and I've got a Fry's savings card or whatever. I don't need a Part D. The penalty, if you don't sign up 10 years later, what happens is when you do sign up for a prescription drug plan, Medicare looks in your record and they say, oh, you've got a 10-year gap in your record. You haven't had a prescription drug plan. So we're going to give you a 1% per month penalty on $33 was the national average this year. I don't know what the national average will be next year, but it changes every year. So the national average of a Part D is $33. So 33 cents a month times 12 times 10 years is your penalty. That amount is tacked on to the monthly premium forever. Now, 2 scenarios I've had this year, very interesting. One lady just is going to play it, and she's shopping for the meds and not doing the Part D. Called me a couple weeks ago and said, what would be the penalty? Calculated the penalty, starting to turn in her mind. No, I'm not doing the Part D. So we're now for $35. Not doing it. So I'm submitting the prescriptions to Canada and going to Mexico and going to different pharmacies. And you could do that. If you pass away with no Part D, of course you're not going to have a penalty. I mean, I've had people tell me, you're not going to have me taking a drug. I'll get into a bariatric, whatever it is, chamber and pumping vitamin C and D and E and everything else before I ever take a medication. Okay, well, you won't be penalized. Now, I had somebody call me, friend of a friend, who 73, and he said, Gary, I didn't sign up for Part D. I got a heart med all of a sudden, and oh man, I'm scrambling. It's $350 a month. Sign me up. I said, I'm really sorry, but you can't sign up. I said, wait a minute, you're a broker. I said, well, yeah, no, I got no power. Remember, I've got no authority. Everybody thinks I have authority. I have no power. You can't sign up. So what do you mean I can't sign up? I'm just calling the insurance company. They're going to tell you, you're in the month of March, you can't enroll in a Part D. You have to do it between October 15th and December 7th. Here he is, 73 years old. He's got a $350 a month med, and he can't sign up until today, and it's not going to be effective until January. So he's scrambling, going to Canada, Mexico, all these other places, trying to find a medication where, using the coupons and the discount things that we download on our phone, some of these meds are expensive. Heart meds, eye drops, little bottles, skin creams, cancer meds. So you've got to make a decision. I was getting ready to say a personal opinion. I can't. So you got to think, is it worth enrolling in just the lowest monthly premium to avoid having a penalty, one, and then two, the what if scenario? You have to make that decision. But there is a penalty if you do not enroll in a prescription drug plan. So again, if you just go to Medicare.gov, it's not stored, nothing is on that website, it shuts down. The donut hole. Everybody's talking about the donut hole. Gary, doesn't that donut hole go away? I thought it goes away. And now it's the gap. And what's this gap thing? Okay. By 2020 coming up, this thing called the donut hole, if you think about a donut, the first part of the donut, 75% of the medication cost is by the insurance company. 25% you pay. When you get to 4,020, you've gotten to the hole. It's not going to really close totally. Because when you're now there, before you get to the hole and you end up paying 50% of the brand name. Now it's 25%. You're going to pay 25% of brand retail cost of what that Part D contracted with the pharmaceutical company. You'll pay 25% of that and 25% of the generics until you get up to $6,350. Now, that's including manufacturer discounts, but here's what's nice about my Medicare.gov that I really like, because I've been doing these reports for the last 9 years, and though I know and understand them, when I print them out and I sit down with somebody to explain it, it's difficult. It's not appealing to the eye. It's just hard to understand. When you see the report now, you're going to see the medications that you put in. When you get to the report, it's going to say clearly, you meet the deductible in March. You get to the gap in July. It tells you, it's really easy. It's not loud and busy. You'll be surprised, I think. And so that will help you to know, when do I get to this donut hole gap thing? So, and then they list it. They've got a spreadsheet. Cost before deductible, cost after deductible, gap, cost after the gap. You'll see it laid out. And it just tells you all those stages of when you'll get to what stage. So depending on your medications, these insurance companies can put one of your medications as a tier 1 to a tier 4. I've seen it. I've seen that. So you're all supposed to be getting letters. If you're on Medicare Advantage or Part D's, they should have given you a letter by now. If you do not have a letter, boy, I got this in January. Oh my goodness. Every January I get a flood of calls, and it's always, I didn't get a letter. My Part D, I didn't know my drug wasn't covered. And you have to, by law, be notified by the insurance plan that you're on, whether it's Medicare Advantage or if it's a Medicare Part D drug plan. Not the supplement. The supplement's different. You just have the monthly premium payment. They tell you when your rates are going up. That's different. You don't have to renew that as long as you're paying a monthly premium. There is no renewal for supplemental insurance plans. But there is this gap. That is changing for next year. Let me just pause right there. I'm going to say thank you. I'm going to end, and I'm going to open it back up, though, for questions and answers. For some of you, you just say, okay, my head's spinning. I need to go. Feel free to go, but if you'd like to stay, please stay, because I'm going to do an answer question live session here with you. Thank you. I really appreciate you coming.